One of the most challenging cases I recently had was a patient who had a kidney stone, which was lodged between the kidney and the ureter. The ureter is a pipe which takes the urine from the kidney down to the bladder. Kidney stones are normally treated with a ureteroscope, which is a device that travels up the ureter to the stone, and then we usually perform a laser fragmentation or breaking the stone up. I was able to free up the stone, but in addition to this stone, the patient had other stones in the kidney. Once you clear the ureter of the stone, you can go into the kidney and then take care of the rest of the stones. In this particular case, the stone was lodged very tightly into a narrow portion of the ureter, and I had to make a decision whether to go in and treat those stones and risk damaging the ureter. So at this point, we utilized our multidisciplinary team at the Miriam and involved our radiology department, which were able to place a tube into the side of the patient into the kidney. This allowed us to then perform a nuclear scan, which allowed us to see that that area was very tight and that it needed repair. The patient went home, but then came back a few weeks later, and we performed a robotic pyeloplasty, which is a procedure we do at the Miriam to cut that area that's very tight out and then reconnect the pipe to the kidney. Prior to reconnecting, I was able to place a special device called a flexible cystoscope and remove the remaining stones. We then reconnected the ureter to the kidney and made sure it was wide open. We also inserted a stent in the patient to allow that area to heal. The patient did well, was sent home within a day, and then came to my office, and I removed the stent about 3 weeks later. And then the patient subsequently has been seen in our kidney stone center, where we were able to do an ultrasound, and that ultrasound showed no stones and no backup. The kidney was healed, and the patient was pain-free, and they remain part of our kidney stone preventive care with our nutrition team as well as our nephrology team.